One of the commonest findings nowadays in an ultrasound or sonography of the abdomen is fatty liver. In today's video, we will be talking about what is fatty liver, how does it impact your health, symptoms seen in cases of fatty liver, a homeopathic medicine along with its approach to help in cases of fatty liver, and finally, natural ways to tackle this condition. So let's get to it. What is fatty liver? When excess amount of fat is stored in the liver cells. Even though the primary function of the liver is to store fat, excess of it can cause problems. Since liver is responsible for various functions of the body, any damage to it can cause a range of health issues. Fatty liver disease is of two types: alcoholic fatty liver and non-alcoholic fatty liver. As the name suggests, alcoholic fatty liver happens because of excessive alcohol consumption, and the other type happens because of reasons other than alcohol consumption. In today's video, we will be talking about non-alcoholic fatty liver disease, that is NAFLD. So what are the causes of NAFLD? Obesity, insulin resistance, and metabolic syndrome. Obesity. When a person consumes more calories than the body requires, it is stored in the form of fat. This excess fat accumulates over the liver. If you must have ever met a dietitian, you must have come across the term daily calorie requirement. For example, a sedentary person requires approximately 1800 calories per day. That is how a diet is calculated. Insulin resistance. Insulin is a hormone which is responsible for maintaining blood sugars, hence thought of as something associated with diabetes. But insulin is responsible for breakdown of food, particularly carbs, into fat and cholesterol. This loads up the liver. Hence, even a little excess in insulin can cause fatty liver. Unfortunately, initially there are no signs and symptoms seen. Patients usually experience symptoms once the disease has progressed. A few people experience symptoms of lethargy, fatigue, and body pain, particularly in the morning. Because this illness is so commonly seen, it is quite ignored until it progresses to other forms of the disease, which I'll be explaining in my video ahead. Whenever I see a patient with a distended abdomen and inadvertently a sonography is done, it shows fatty liver. So what exactly happens because of insulin resistance? Because of excessive fat accumulation on the liver, it does not respond to insulin as it should. This creates a feedback mechanism to the pancreas to secrete more and more insulin. Let me explain it this way. Imagine a class full of children where they are not listening to the teacher. So the teacher starts speaking in a stern voice in order to get the work done. Here, the pancreas are secreting more and more insulin, but this creates more trouble for the liver as the liver becomes fatter and fatter. Metabolic syndrome. This is basically a cluster of diseases. For example, high blood pressure, increased cholesterol, and high diabetes, which can lead to NAFLD. On the basis of severity, NAFLD can be divided into the following 4 stages. First, simple fatty liver. Here, there is excessive accumulation of fat in the liver cells without any inflammation. Second, steatohepatitis. Along with fatty accumulation, there is inflammation as well as damage to the liver cells. Third, fibrosis. At this stage, there is development of scar tissue, which might cause depletion in the liver function. Fourth, cirrhosis. This is the most extreme form of the disease. During this, there is extensive damage as well as scarring to the liver. Fortunately, liver cells are the only cells which are capable of regeneration. However, this process happens over time. So what are the symptoms seen in cases of NAFLD? In the initial stages of the disease, hardly any noticeable symptoms are seen. Few people experience fatigue and body pain after waking up in the morning. However, as the disease progresses, the following symptoms may be seen: pain or discomfort in the upper right abdomen, bitter taste in the mouth, nausea and vomiting, distension as well as bloating of the abdomen, spider veins, itching all over the body, jaundice. In severe cases, there might also be confusion as well as difficulty in concentration. Coming to the homeopathic medicine for fatty liver. For people who do not know how homeopathy acts, let me explain it in brief. Homeopathic prescriptions aren't based on diagnosis of the illness. Instead, it relies upon the symptoms projected by the patient. For example, Two patients of fever might not require the same medication on the basis that one patient has increased thirst and the other patient has decreased thirst. I shall be making an in-detail video about homeopathy and its action soon. I hope it clears all your doubts. Coming to the medication, a prominent liver remedy for fatty liver in homeopathy is Chelidonium majus or celandine. It is a right-sided medication. So if you have complaints, it will be particularly on the right side of your body. There is alternating diarrhea and constipation. There is extreme desire for hot drinks as if boiling, thick yellow coating of the tongue, pain in the right upper abdomen along with distension and bloating. There is constant pain in the right inner angle of the scapula or the lower shoulder blade, yellowish discoloration of the skin as if jaundiced. Chelidonium majus is one of the topmost medication in homeopathy for jaundice. At my clinic, I use Chelidonium in the mother tincture form or the 30th potency. But for fatty liver, mother tincture works best. Dosage for the same would be 10 drops in half a glass of water thrice a day after your meals for a minimum period of 3 months. Coming to the natural ways to help fatty liver. Before I explain this, I do not want you to have the understanding that doing these things will help you overnight. It is going to be a gradual process, towards the end of which it will help improve your overall health. Exercise regularly. Exercise helps reduce fat, improves insulin resistance, as well as improves the overall health of your liver. Aim for brisk walk for at least 30 minutes or moderate intensity exercises for at least 5 days a week. Reduce weight. Obesity is one of the leading causes of NAFLD. Losing weight helps reduce accumulated fat over the liver. Make sure it is done in a slow and steady manner with the help of diet and exercise. Consume foods which are rich in omega-3 fatty acids, as this has an anti-inflammatory effect which helps reduce inflammation over the liver. Reduce intake of foods which are rich in refined carbs and sugars as well as fats, as this increases chances of insulin resistance. Consume foods which are rich in choline like eggs and liver, as this is known to have lipotropic effects. That is, it helps dissolve fat in the liver as well as transport it outside the liver cells. Aim to sleep at least for 7 to 8 hours daily, as lack of sleep triggers insulin resistance. Consume foods which are rich in potassium like sweet potatoes, bananas and spinach. Potassium is known to help in regulation of blood pressure as well as has anti-inflammatory effects, both of which contribute to NAFLD. Potassium is also known to have protective effects against liver toxins. Consume cruciferous vegetables like cabbage, cauliflower and broccoli. These are known to have antioxidative effects, anti-inflammatory effects, as well as improves the overall health of your liver. You need to understand that only consuming cruciferous vegetables is not going to help. You need to have a balanced diet which includes all the vegetables. If this video helped you, do like and share with your friends. If you have any questions regarding fatty liver, do leave a comment below. I'll be more than happy to help.